If you want.
697 Shed, and their website is
What kind of music you play?
theshedkings.com.
80s rock.
And good morning, Rim Country. Chris Higgins in the studio here at the Sawmill Movie Theater Complex. Hope you are having a wonderful day. Well, this morning on our Community Spotlight program, sponsored by the Shed Kings in Star Valley, we are going to be talking about the Tonto Apache Healthcare. And in the studio, we have Tribal Chairman Calvin Johnson. Good morning, Calvin.
Good morning.
And we have Jessie Balcom and Lisa Carrasco. Good morning to all of you.
Good morning.
Hey, thank you so much for coming in this morning to talk about the Tonto Apache Healthcare. And there might not be a lot of people that realize that the healthcare facility is out on the Tonto Apache Reservation.
Right.
Or if they are aware of it, maybe they don't know about all the services that are provided at the facility. So I think it would be good though, Calvin, if maybe you could give all of our listeners and viewers a history, like how it got started, why it got started, how long ago it started, this whole process.
All right. This started out as an idea, just an idea with the Tribal Council maybe 10 years ago. And we looked into doing it. But at the time, we were just busy doing other things, so we kind of put it off to the side. So then when COVID hit, right before COVID hit, we started working on it. And then, funds became available, so we went full board with it. We did it as a way to provide better health care to our members and also to our employees. So we've been working on this for about 5 years now. We opened about two years ago, and we're in the stages of getting credentialed from other insurance companies, and I think Jessie will talk about that later, which ones we are credentialed with. But moving forward, we also want to open it up to the public. We've seen a need there, and one of the things that is unique about our clinic, and it's mostly walk-in. We do take appointments, but 80-90% of the people that come in are walk-ins. So and a unique thing also is we do home visits with our providers. If the members are too sick to come in, then our providers make house calls.
Wow, that's a big plus for people, like you said, that are too sick to come in, or they have that option.
Yes.
So instead of having to, make it into the healthcare clinic, a provider can come to their house. So what are some of the services that are currently provided at the healthcare facility?
So as of right now, we offer primary care services in order to manage chronic disease management and also preventative care. Preventative medicine is a really big thing that we highlight on. Even trying to recruit some of those patients earlier on in becoming invested in their health care and coming in and being able to get their annual examinations. As we know, Payson has a long-standing history of lack of resources and access to care. Primary care providers is a shortage in Payson. So we like to be able to provide that service for our community, also tribal members and employees. The other thing that we offer, like Calvin spoke about, our chairman, is the walk-in services. There are a lot of patients that don't have access to their primary care providers or even access to care in a timely manner. We know that ends up in a hospitalization or maybe an unnecessary visit to the emergency room. When that happens, it's a financial burden to some of those patients in order for their deductible, co-pays, etc., or even if they're uninsured, they're getting large medical bills of going to the emergency room. So we like to be able to offer access to care that maybe you don't have an establishment with us, we carry your insurance, or maybe you're uninsured and you have the ability to pay cash and come see us. we can be able to provide services to or do the workup that will prevent you from going to the emergency room or the hospital. So appointments are readily available. Patients, primarily, they can walk in, they can see us. We try to get patients in a timely manner if we do have patients that have scheduled appointments around that time. So primary care services, acute illnesses, chronic disease management. Lisa can talk more about some pain management services that we also offer. And one other thing that we're exploring and looking at and offering soon is behavioral health management and also substance abuse management. That's also another resource in Payson that we know is lacking and that we can be able to provide to our patients.
Wow. One of the services you mentioned, I think that is great to hear you say is a preventative, or to offer services to hopefully prevent
Yes.
the disease from happening or getting worse.
Yes.
And that's not, I think it's becoming more prevalent, but typically with healthcare, it's okay treating the issue or treating the problem when it occurs, when it happens, when it manifests. But preventative isn't focused on as much. I think that's starting to change because of the benefit of doing that. So it's great to hear that, that's one of the focuses and what you've been doing.
And I think we saw a lot of that during COVID, that patients didn't have access to care. And so maybe some of those routine surveillance screening opportunities they could have had during that time was missed for 2 to 3 years because of lack of access to care or even procedure-wise. So now we're trying to play catch-up in capturing those patients and getting their preventative care in hopes that we could maybe catch something that will may manifest later on, like you said.
And before the program, we were talking, you and Lisa were talking about how long, each of you have been with the healthcare clinic, and you've been there from the beginning, haven't you?
Yeah, so Calvin had recruited me at the initiation or at the start of the clinic, so I've been there. It's been almost 3 years. My background is emergency medicine, so I've been a nurse practitioner for 7 years. But now my primary focus is partnering with the tribe and trying to provide the best care for our patients.
Oh, very nice. And Lisa, how long have you been with the healthcare clinic now?
I'm going on a year now. Next month will be a year.
Wow.
Yeah.
Great. And your primary focus is, or one of them is pain management?
Yes, so I originally started in pain management. When I came up here, I was mainly doing primary care with the clinic, but felt that there was a need for pain management here. So I can offer now is initial evaluations, if needed, medication management, referrals to physical therapy, if the problem is more severe, referral to neurology or any other type of spine doctor that is needed.
Wow, and pain management, there's a big need up here for pain management, isn't there?
Absolutely, yes.
Wow, yeah, because it, I guess that goes into so many areas, back or, if people have injuries, different injuries, but also, goodness, just cancer, joint pain.
Yes,
Yeah.
there's so many different pain management.
Yeah. Yeah, and with a older population, for the most part, there, are quite a few people.
Yeah.
So, do you notice treating an older demographic mainly, or all ages, or?
To be honest, it's all ages.
Oh, okay.
Yeah,
Wow.
Stemming from mid-20s to 80s.
Mm-hmm.
So pain is a serious problem, and what's important is we use multimodalities to treat pain, so it's not just pain medication or medication management. What my goal is to get them to the best quality of life.
Mm-hmm.
We're never going to take the pain away completely, but what we can do is offer them enough pain management so they can have a good quality.
Yes.
No, that's so true. And, depending on the patient, it's good you have a lot of different modalities that you're working with, because what works for one patient might not work as well for another. They might not be receptive or responsive to that for whatever reason.
Right.
So it's great to have a lot of different tools in your toolbox instead of just maybe prescribing medication, painkillers. And I'm sure the less painkillers that can be prescribed or be out there, the better that is.
Absolutely.
Yeah.
I mean, pain medication is good for acute problems, acute pain, but in the long term, it's not a really good choice. And so trying to use different modalities is the best for patients that are suffering from pain.
So, Calvin, tribal members must really, I think, appreciate and probably really utilize the healthcare facility.
Yeah, and they have a lot of pride in the healthcare clinic that we have, because for a long time, 70s, 80s, tribal members didn't have insurance. So they had nowhere to go. There were a couple doctors here in town that treated a lot of the tribal members, but now they have that option to come down whenever they want and be seen by, and take pride that it's their clinic. And we, like I said, we offer it to also to the community. We want to do our part in keeping the community healthy. So that's why we went out and recruited some of the best, doctors and nurse practitioners that we felt fitted our need. We also have another one, McKinsey, who specializes in mental health. So not only primary care, but in mental health also. So as Jessie mentioned before, that's an area that we're gonna get into. We partnered with some psychiatrists and psychologists in California, so we'll be offering that service also.
That's great. And then there's also been some partnerships. I don't know how many. I just know of one, but for dental services.
Yes.
So Dr. Brett Flaherty.
Dr. Flaherty, yes.
Yes.
We just went into a partnership with him. He will be out there starting out once every 2 weeks, I think, on every other Friday, and then building up the patient database from there. And as the need goes, it might be more days, but he's also starting to come out there.
No, that is great. Again, if you're just tuning in or just started watching, we're talking about the Tonto Apache Healthcare Facility and talking with Tribal Chairman Calvin Johnson and also Jessie Balcom and Lisa Carrasco, both with the healthcare facility. And so, open house. I know a date hasn't been set, but you guys really want to get this out to the entire community, have an open house. So approximately when are we looking, Jessie?
We're hoping in June, so we do have a Facebook page. So when we get a date and time established, we'll post that on our Facebook page, kind of get out to the community. We can also let you know if you would like to advertise for us.
Yeah, definitely.
But we're really excited to be able to offer services and open up to patient community. We do have health insurance contracts right now, and we're looking to expand as well. So as of right now, we have Medicare. We're not currently taking Medicare Advantage, but that's something that's coming. We have Blue Cross Blue Shield of Arizona, Cigna. We also have Aetna, and then also Banner Aetna as well, which the Banner employees up here in Payson are card holders for. So we are looking at adding additional contracted payers, but when that information, we get that updated, we can let everybody know on our Facebook page as well.
And I'm sure a lot will probably happen between now and June, possibly, or the open house where more might be added, or you'll, just have more information.
Yes, and we're working on updating our website. As of right now.
Yes.
So you may see a website out there, but it's under construction. So there are some great things to come in hopes that patients will have access to all the services we offer, including appointment bookings, etc.
Oh, very nice.
And this is, if I may, this is just the beginning. We have plans in the future, 3 to 5 years from now, opening up a small ambulatory clinic across the street and on the property we have across the street. And we are in negotiations, I can't say who with, but we will have offer a lot of different specialties that will come up on a rotating basis, such as heart, cancer, all those other diseases. So hopefully, you know, in the future,
Mhm.
will be bigger, better.
Expanding it.
Yeah, expanded.
And expanding. Wow. Yeah, there's a lot going on. A lot
Yes.
going on, you know, with the tribe, with the land, with the Apache Corners, just a lot happening. So it's exciting. It's exciting to see all good things, all things that are just going to benefit not only the tribe and tribal members, but the entire community.
Right, exactly. A lot of things that we do, we take the community in mind because, you know, we were all born and raised here,
Mhm.
and we consider Payson our home, and we're going to be here forever. So
Mhm.
we just want, you know, we won't do anything that hurts the town. We welcome, you know, to providing services to them also.
Mhm. No, that is good. So, what are some of the other, I don't know, things that maybe you want to discuss, put out there, talk about?
I think one thing that's important is that we do offer a cash pay option. So
Okay.
if you're uninsured, or maybe we don't have a contract with your insurance, there's still the ability to come see us, and there's a cash pay option. So you can give our clinic a call, we can kind of go over the details, but no matter what, we are wanting to see these patients, and we want to offer services to everybody.
It'd be good, your phone number, a number for
yes.
people to call.
Yes, so if you have a pen handy, it is 928-472-3906.
Great. And location, it's right there, and I guess, I believe most people have been out,
Out to the casino.
yeah, out to the casino for, you know, an event, to go out to eat, or for whatever reasons, to win some money, or make a donation like I
Right.
usually do. But right across from the casino.
Yeah,
and
directly south of the casino.
directly south, just before the police, I believe.
Yes,
The police
it's
building.
right at the curve.
Right at the curb there. So, yeah, you can't miss it, and again, you can call. Or is there a way to also message through your Facebook page? Can people contact that
Yes,
way?
that is an option as well. I wouldn't recommend that being the first option,
Gotcha,
just if that's not, if there's not surveillance daily, you know, on that, I would recommend calling the clinic. And I guess it would be important to know what days we're open as well. We're open Monday through Thursday, 7 a.m. to 5 p.m. We are closed between 12 and 1, but we start earlier in the day, so that provides patients prior to going to work if they need to come in. One of the nice features we do offer is we do phlebotomy in-house, and then we will send the lab specimens. We contract with Sonora Quest, so we can have your specimens picked up at the clinic. So it's really all-inclusive. If you come in fasting for your annual examination, we can get everything done in one visit.
So that's the blood draws of phlebotomy services. They're open to anyone?
So preferably, we would like you to be established with us.
Okay.
And then we can talk about that, is if we are your preferred provider or primary care, and maybe you have an order from a specialist that we referred you to, you can bring the order in, that would be fine, we can do that. But we're not designated as a draw station for Sonora Quest, but it's a
Correct,
service that we
okay.
like to offer for our patients.
Yeah, because I know, boy, if anyone listening or, you know, watching hears that, because Sonora
Yes.
Quest
Yes.
is very, very busy.
Yes.
And stays very busy. I know because my wife works there. She's a phlebotomist. So she, every day, it's kind of like Groundhog Day for her, where I'm like, hey, how was today, hon? Busy.
Busy,
That's the
yes,
first,
yes.
busy. So, so that's a great benefit for
Established
your
patients,
yes,
yes.
patients, exactly, for your patients. Wow, that's really good. So Lisa, other services, pain management is one. Is that your main kind of service or background?
No, I do primary care as well.
Okay.
So, but my specialty is pain management. I don't know if we mentioned, we do telemedicine as well.
Oh, wow,
So if a
yeah.
patient can't come in, we can offer telemed.
Yes.
So you offer telemedicine along with the home visits for patients that can't get out of their home, they're too sick to leave their home, so that is an option as well.
Yes.
Wow, and is that anywhere in Payson or just on?
I think, well, right now it's just on the reservation.
On the reservation,
So if
okay,
we,
just, yeah.
If we see the need,
Mhm.
then maybe that's something we can offer,
Mhm.
offer to our patients.
Gotcha, but for right now, that
Yeah.
is just for tribal members
Right.
on the reservation. Okay,
But telemedicine is for everybody.
yes.
Yes.
Yeah, telemedicine, it's amazing, the advancements and what doctors or specialists can do through telemedicine. I mean, having a visual, but seeing all of the data, seeing, you know, vitals, just everything, history, having all that information and being able to diagnose, treat, assist. So if you have a specialist that is in another state, another country, wherever, and they're assisting you with treatment of your patient.
Yeah.
So, yeah, that is amazing. Wow. So again, open house will be coming, hopefully sometime in June,
Yes.
but it will be announced on Facebook page, Tonto Apache Healthcare Facebook page. Also, yeah, we'll be sure to get that out there to people. So that'll be exciting. And it'll be exciting to see as services are added and just the expansion of the healthcare facility. All right, anything else you'd like to share? Again, hours, Monday through Thursday, right?
7 to 5.
7 to 5. Yes, all
What
right.
about the in-house pharmacy?
Oh, yes.
Oh, in-house pharmacy.
Yeah, we saved the best for last.
Oh,
Wow,
yes, yes.
Yeah, so tell us a little bit about,
Oh,
yeah.
So we do offer a limited variety of medications in-house.
Okay.
So, for example, if you come to us and you need a prescription for your acute illness, we can prescribe the medication in-house and dispense it.
Oh, wow.
So we partnered with a company where we have pre-packaged prescription medications based off of what we would normally prescribe to a patient, and we can dispense it on-site. We're working in contract and negotiations with the insurance plans, so we can also bill, but that is something that we can offer to our patients. So it may not be right now for the community of Payson, but right now for the casino employees or the employees of the tribe and tribal members, we are dispensing medications for them.
Wow.
And we are
Yes.
we are gonna open up a pharmacy in
Yeah.
town.
Yes.
We're just looking for a location,
Wow.
because we
Yeah.
can get a kind of better deal than most people, most
Mhm.
companies.
Mhm.
So hopefully that'll come within 6 months.
So in all of these services, everything that you're currently doing and everything that that you're planning on doing, just listening to them, I guess somebody could just say, oh wow, okay, there's this service or that service, and maybe not understand all of the work it takes to get
Yes.
these
To that point.
established, to get to this point. And it just doesn't happen overnight. It's not like, oh, I'm gonna open a business, like I'm gonna just open this store or that store. But in the medical field, and to get these contracts, to get the licenses, to get everything established, there's a
That takes
lot of
time.
work and time that's gone into all of this.
Right, yeah, there's a lot of thought process to,
Mhm.
to reach to that point where we're ready to open. There's
Mhm.
contracts, there's negotiations, there's price negotiations with other companies.
Mhm.
Then the lawyers have to get involved.
What? No way. No way.
So
What is-
that kind of delays the process a little bit
Yeah.
because, everybody's got to get paid. But, it's just something that we feel the need in the community. So.
Mhm.
It's worth it.
Yeah.
It's worth the hard work.
Yes, no, it is a lot of hard work that's been put in by quite a few people.
Yes, all of us sitting here,
And how many others are at the clinic? Like, what does the staff look like? How many?
We have a great team.
Mhm.
I'm so proud of everybody that I work with. So I would say our providers, Lisa and I, and then we have Mackenzie, she's a physician assistant. We all take time with our patients and want to be able to invest in them for the best care possible. But we also have our unit clerk who also makes appointments and will get the patients updated in the system, Cassie.
Mhm.
She's great to work with, also, patient oriented, wants to advocate for the patient. And then we have Peggy, our nurse. She's amazing as well. She's a huge advocate for the patient. She has great relationships with all of our patients. They like to try to call her personally whenever there's a need. So we have a great team. Everyone communicates. It's very seamless. So I would have to say we're the best.
Yes.
Yeah, no one will be turned away.
Yeah.
I mean, we will make it work to provide care for everybody.
No, that is great, and it's exciting. It's exciting to
yes.
see, this service for tribal members, but also for the community, and how that's just going to continue to grow and expand. Well, any other last thoughts? Or, I mean, there's a lot that, we talked about, covered, shared, any other services maybe that you'd want to mention or highlight or talk about?
Well, no, just know that we're always trying to be better and do more for our community. So even though we will accomplish getting this clinic open for the community, it's not going to stop just there. Like Calvin said before, and Jessie, we plan to expand and reach as many people as we possibly can to give them the care they deserve.
Yeah, one thing I must add, one thing we're also working on in conjunction with the pharmacy is we will be opening up an urgent care facility.
Oh, wow.
Which will be open, that's, right now we're doing all the groundwork for that, and that won't be on the reservation, that will be in town somewhere.
Oh,
We
wow.
just have to identify a location, and that'll be a whole new set of providers that will work there, but the hours on that one will be late to like 10 o'clock at night,
Oh, wow.
weekends.
Okay.
And the nice thing about that is if you go to the urgent care and you fill your medications at the pharmacy, that automatically establishes you within the Tonto Apache healthcare system. So
okay.
you want to come see us for your primary care services, or maybe a follow-up from your acute sickness that you had, there's the opportunity to do so, because we'll have you established with us.
Wow. Wow, there's a lot, a lot happening, a lot coming. Again, you can follow Tonto Apache Healthcare on Facebook to learn about the services. Also, the phone number again, Jessie?
It's 928-472-3906.
There we go. And Monday through Thursday from 7 a.m. to 5 p.m., correct?
Correct.
Yes.
Awesome.
And I must add, on our Facebook page, one of the things we're gonna have videos on there.
Okay.
These two don't know about it, but they're gonna be,
Surprise!
little classes, just
Yeah.
educational purposes. What to look for,
Yeah.
just things, small little videos.
Yeah, information. on
Information.
videos. Wow.
I like it.
That is great. Yeah, see, you two learned something as well.
That's something new every day.
Yeah.
One thing I did forget to add is
Uh-huh.
one little service that we offer
Yeah.
is the IV hydration services. So
Oh.
the vitamin infusions, Meyer
Yeah.
cocktail. Simply, if you feel like you're dehydrated, there's a need, we can do that in the clinic as well. So we have a menu of
Oh.
different, items that we do offer.
Mhm.
And I would say we're very competitive in relation to the other prices. So
Mhm.
we try to be able to offer that service to the community at an affordable price.
Nice. Wow. See, the list goes on and on.
And you may
on.
see specials on our Facebook page for vitamin infusions or B12 injections. So that's a good spot to watch for any specials that we may have going on.
Hey, well, there you go. That sounds great. I know those are, they've become very, very popular. They're very beneficial. Yeah. Well, all right. Well, thank you again, all of you, for coming in today. Thank you, everyone, for listening and watching. Also, thank you to the Shed Kings for sponsoring our Community Spotlight program. Time to get back to the music with America, Leonard Skinner, and the Eurythmics, and more. First, let's get an update from the National Weather Service and a message from our sponsors, the Shed Kings. All right, you guys have a wonderful day.
With this morning's KRIM,
Thank you.
The Shed Kings, offering 2 convenient locations in Star Valley and Overgard, Arizona.
Hey there, I'm Curtis. And I'm Anthony. And we're the Shed Kings, home of the rent-to-own, no credit check program.
We offer barns, sheds, garages, cabins, and steel buildings, all built to last. Proudly representing Graceland Portable Buildings, industry leaders for over 20 years. Need something larger? We also represent American Steel Buildings for unmatched durability and the best warranties in the business. Quality matters. If there was a better constructed building on the market, we would be selling it.
Shed Kings made it so easy, but quality's unbeatable. I loved it so much, I joined the team.
Enjoy enhanced floor and wall durability, optimized fasteners, and budget-friendly options. Choose from a wide variety of styles and colors to fit your needs. Graceland Portable Buildings has the highest customer quality ratings year after year.
So come see us in person and experience the Shed Kings difference, because we have the shed you've been looking for. If not, we can build it. Call or visit us to get started.
Welcome to Shed Kings, offering 2 convenient locations in Star Valley and Overgard, Arizona.
Hey there, I'm Curtis, and I'm Anthony, and we're the Shed Kings, home of the rent-to-own, no-credit check program.
We offer barns, sheds, garages, cabins, and steel buildings, all built to last. Proudly representing Graceland Portable Buildings, industry leaders for over 20 years. Need something larger? We also represent American Steel Buildings for unmatched durability and the best warranties in the business. Quality matters. If there was a better constructed building on the market, we would be selling it.
Shed Kings made it so easy, but quality's unbeatable. I loved it so much, I joined the team.
Enjoy enhanced floor and wall durability, optimized fasteners, and budget-friendly options. Choose from a wide variety of styles and colors to fit your needs. Graceland Portable Buildings has the highest customer quality ratings year after year.
So come see us in person and experience the Shed Kings difference, because we have the shed you've been looking for. If not, we can build it. Call or visit us to get started.
Welcome to Shed Kings, offering 2 convenient locations in Star Valley and Overgard, Arizona.
Hey there, I'm Curtis, and I'm Anthony, and we're the Shed Kings, home of the rent-to-own, no-credit check program.
We offer barns, sheds, garages, cabins, and steel buildings, all built to last. Proudly representing Graceland Portable Buildings, industry leaders for over 20 years. Need something larger? We also represent American Steel Buildings for unmatched durability and the best warranties in the business. Quality matters. If there was a better constructed building on the market, we would be selling it.
Shed Kings made it so easy, but quality's unbeatable. I loved it so much, I joined the team.
Enjoy enhanced floor and wall durability, optimized fasteners, and budget-friendly options. Choose from a wide variety of styles and colors to fit your needs. Graceland Portable Buildings has the highest customer quality ratings year after year.
So come see us in person and experience the Shed Kings difference, because we have the shed you've been looking for. If not, we can build it. Call or visit us to get started.
Welcome to Shed Kings, offering 2 convenient locations in Star Valley and Overgard, Arizona.
Hey there, I'm Curtis, and I'm Anthony, and we're the Shed Kings, home of the rent-to-own, no-credit check program.
We offer barns, sheds, garages, cabins, and steel buildings, all built to last. Proudly representing Graceland Portable Buildings, industry leaders for over 20 years. Need something larger? We also represent American Steel Buildings for unmatched durability and the best warranties in the business. Quality matters. If there was a better constructed building on the market, we would be selling it.
Shed Kings made it so easy, but quality's unbeatable. I loved it so much, I joined the team.
Enjoy enhanced floor and wall durability, optimized fasteners, and budget-friendly options. Choose from a wide variety of styles and colors to fit your needs. Graceland Portable Buildings has the highest customer quality ratings year after year.
So come see us in person and experience the Shed Kings difference, because we have the shed you've been looking for. If not, we can build it. Call or visit us to get started.
Welcome to Shed Kings, offering 2 convenient locations in Star Valley and Overgard, Arizona.
Hey there, I'm Curtis. And I'm Anthony, and we're the Shed Kings, home of the rent-to-own, no credit check program.
We offer barns, sheds, garages, cabins, and steel buildings, all built to last. Proudly representing Graceland Portable Buildings, industry leaders for over 20 years. Need something larger? We also represent American Steel Buildings for unmatched durability and the best warranties in the business. Quality matters. If there was a better constructed building on the market, we would be selling it.
Shed Kings made it so easy. The quality's unbeatable. I loved it so much, I joined the team.
Enjoy enhanced floor and wall durability, optimized fasteners, and budget-friendly options. Choose from a wide variety of styles and colors to fit your needs. Graceland Portable Buildings has the highest customer quality ratings year after year.
So come see us in person and experience the Shed Kings difference, because we have the shed you've been looking for. If not, we can build it. Call or visit us to get started.
Welcome to Shed Kings, offering 2 convenient locations in Star Valley and Overgard, Arizona.
Hey there, I'm Curtis. And I'm Anthony, and we're the Shed Kings, home of the rent-to-own, no credit check program.
We offer barns, sheds, garages, cabins, and steel buildings, all built to last. Proudly representing Graceland Portable Buildings, industry leaders for over 20 years. Need something larger? We also represent American Steel Buildings for unmatched durability and the best warranties in the business. Quality matters. If there was a better constructed building on the market, we would be selling it.
Shed Kings made it so easy. The quality's unbeatable. I loved it so much, I joined the team.
Enjoy enhanced floor and wall durability, optimized fasteners, and budget-friendly options. Choose from a wide variety of styles and colors to fit your needs. Graceland Portable Buildings has the highest customer quality ratings year after year.
So come see us in person and experience the Shed Kings difference, because we have the shed you've been looking for. If not, we can build it. Call or visit us to get started.
Welcome to Shed Kings, offering 2 convenient locations in Star Valley and Overgard, Arizona.
Hey there, I'm Curtis. And I'm Anthony, and we're the Shed Kings, home of the rent-to-own, no credit check program.
We offer barns, sheds, garages, cabins, and steel buildings, all built to last. Proudly representing Graceland Portable Buildings, industry leaders for over 20 years. Need something larger? We also represent American Steel Buildings for unmatched durability and the best warranties in the business. Quality matters. If there was a better constructed building on the market, we would be selling it.
Shed Kings made it so easy. The quality's unbeatable. I loved it so much, I joined the team.
Enjoy enhanced floor and wall durability, optimized fasteners, and budget-friendly options. Choose from a wide variety of styles and colors to fit your needs. Graceland Portable Buildings has the highest customer quality ratings year after year.
So come see us in person and experience the Shed Kings difference, because we have the shed you've been looking for. If not, we can build it. Call or visit us to get started.